we are all increasingly aware of the HCV epidemic. Approximately 130 to 170 million people, 3% of the world's population, are living with chronic hepatitis C infection. Hepatitis C is divided into 6 distinct genotypes throughout the world, with multiple subtypes in each genotype class. 85% of the people affected will develop chronic infection. 3 out of 4 persons living with HCV do not know it. Hepatitis C is the leading cause in liver transplantation and liver cancer worldwide. HCV represents 350,000 to 500,000 annual deaths. It's well known that patients with hepatitis C are at risk for significant complications, such as long-term liver damage and the development of fibrosis, cirrhosis, hepatocellular carcinoma, and even death. But did you know that the impact of hepatitis C goes well beyond the liver? Chronic HCV infection causes changes in the immune system that can affect virtually every organ. Whereas progression of liver disease may take several decades, damage beyond the liver may appear early. As many as 3 out of 4 people with HCV experience complications beyond the liver, such as kidney problems, heart disease and stroke, and mood and brain disorders. Kidney. HCV infection may impair kidney function over time, and it appears to increase the risk of developing chronic kidney disease. HCV infection can be particularly harmful for patients receiving dialysis or kidney transplants. Heart disease. HCV infection may promote buildup of plaque deposits in arteries, increasing the risk for both heart disease and stroke, especially in patients with diabetes or hypertension. Mood and brain disorders. HCV infection also has been linked to fatigue, depression, anxiety, and cognitive impairment, which can reduce quality of life for patients living with HCV. There are additional immune-related extrahepatic manifestations, scientifically known as different grades of cryoglobulinemia vasculitis, which appears in roughly 80% of cases. Cardiovascular disease and lymphoma have also been reported. These complications can lead to heavy direct and indirect costs, both for patients and for health systems. Direct medical costs for patients with HCV have been shown to be 76% greater than for patients without HCV. Moreover, the direct healthcare resource utilization and costs associated with chronic HCV increases with the progression of the disease severity. However, the standard of care for HCV is changing rapidly, and new therapies have emerged over the last years. These new therapies are demonstrating high cure rates in real world, similar to the outcomes of clinical trials, and may reverse many of the complications associated with HCV. Also, there is an opportunity for better and holistic management of HCV through multidisciplinary teams. A lot of learnings and best practices have been identified in centers of excellence. The Quantum KPMG project is a great source of improvement in quality care. Awareness of the broader picture of HCV is vital. Even if liver damage is not apparent, early diagnosis and treatment for HCV is important to help control the inflammation that can lead to multi-organ damage. In fact, EASL treatment guidelines recommend that treatment priority should be given to patients with extrahepatic manifestations regardless of their liver fibrosis stage. Recognizing the importance of manifestations beyond the liver is crucial to allow patients and their doctors to make timely decisions about their treatment. The cost of inaction is very high. Now we have the reasons to move forward. There are new opportunities. It's time to act. Healthcare authorities and all parties involved should consider to increase awareness of HCV worldwide, understand the damage beyond the liver, recognize a global response is needed for tackling this disease, ensure proper planning and funding for broad access to appropriate treatments, in order to treat all and treat early.